Hi, everyone. Thank you for joining us. Maddie, if you want to go to the next slide. Let's see. There we go. So my name is Julie. As Mariah said, I'm going to start off with what the learning objectives for our discussion today are. We do want you to be able to list the types of data which have regulatory requirements for confidentiality, protection, and their privacy. We're hoping that you'll be able to recognize your legal and contractual role in these protections and the penalties for noncompliance. We want to differentiate between identified, de-identified, and limited data sets and their storage and give examples. Identify the requirements for your access to Corellian systems and patient data, and describe Corellian's secure research environment and list several available software programs. And we're going to outline the process for new software consideration. I think I'm going to talk for a little while first on some of these, and I'll pass off to Maddie and Nick later. As far as some of the contractual or regulatory regulations with data, we want to talk about some of the main requirements for confidentiality. So, and we're looking at not just for, Corellian data, but also if you happen to have a joint appointment or you're working at a research institution like Virginia Tech that isn't a healthcare entity. So we're going to go over a list of different types of data from both. So we have personally identifiable information, PII. And this is anything that identifies someone. So even if you're doing a survey, outside of Corellian, where you might be asking people for information about themselves, it might be tied to sensitive information, or it might not be. But just the fact that you're gathering information about people's identity requires some, us to think about the confidentiality of that data. And then we have protected health information, which would be we call it PHI, and that's coming from patients. Again, identifiable information about patients. And we also have regulations we have to consider when we're working with students and when we're collecting data from students at like the university at Virginia Tech. And that data is regulated by the Family Educational Rights and Privacy Act. We call it FERPA. And at Virginia Tech, we also have regulations for Department of Defense contractual data that we receive or that we collect. Things like ITARs, one of the regulations, and DFAR, like Office of Export, things that we're thinking about, working with, controlled data or classified uncontrolled data, CUI. And then there's also just company confidential information. So information that you want to keep inside your institution that you don't want to be sharing out publicly. And in the research world, we also want to be thinking about intellectual property. So your ideas, your inventions, things of that nature, we want to protect that as well. It is important when we're looking at research data for researchers to understand that they are the stewards of the data. So as a researcher who's collecting data and working with data, you're expected to be a good steward of the data, but that does not mean that the data is yours or that you own the data. The institutions own the data, and also the people who the data were collected from have certain rights to how that data is used. Next slide, please. So we also need to think about contractual obligations. In some cases, when you're conducting research, you might have data that might not be protected health information or regulated by HIPAA. It might be even de-identified data. But if you have a contractual obligation to protect it, either from your sponsor or because you received the data from another institution in a data use agreement, you have to protect that data according to the terms of those contracts. So it's important to understand as a researcher what those contracts say and how they say you must store it, who can access it, what you can do with it. Just because it might be de-identified doesn't mean that you can post it anywhere that you wanted. We have to be aware of those contractual obligations. The same with material transfer agreements, non-disclosure agreements, and access confidentiality agreements that our institutions might be entering with one another or other third parties. it's important that researchers understand those agreements are there and that they understand what's in them. And then the environment where you decide to put your research data and process it and analyze it, and the tools that you're using must be appropriate for the project. So we have to look at understanding first what data do you have, what regulations are required, what your sponsor has required, and then Carilion and Virginia Tech both have risk classifications, and certain places are okay to process and store and collect different types of data. So we classify the data, and then we, based on that classification, we choose the environment where we're going to work with the data. Next slide, please. And it is important to note that different institutions are going to have different regulatory requirements. So when you're working and collaborating with other people from other institutions, it's important to understand the policies and requirements and regulations that apply to both institutions. So these collaborative projects require compliance with all parties' requirements. So it isn't, if I'm at Virginia Tech, but I'm working with, Carilion, I have to not only know and comply with Virginia Tech's, but also with Carillion's. So when they differ, we go with the most stringent. Whatever the most stringent, most protections are the ones that we will follow, not the least stringent. Next slide, please. So most people in your field here are familiar with HIPAA, the Health Insurance Portability and Accountability Act of 1996. Within HIPAA, there's the privacy rule, and it addresses the use and disclosure of an individual's health information, and that's what we're calling protected health information by organizations that are subject to the privacy rule. And those organizations that are within scope of the privacy rule we call them covered entities or HIPAA covered entities. And they follow these standards that are set for individuals' privacy rights and for an individual to understand and control how their health information is used. And so this is, this is important not just because there's a regulation out there telling us it's important. It's important because we are all patients, and we all are individuals who care about our privacy. Different people have different levels of comfort with that, but it is really important. I always go back to it isn't we don't do this just because we're trying to comply with HIPAA. It's because we really do want to protect individuals that we're working with. Something that's really important to note is that Carilion is a HIPAA covered entity, and Virginia Tech is not a HIPAA covered entity. So it doesn't mean Virginia Tech doesn't need to protect research data or protect an individual's, privacy and rights. It means we have different regulations we follow, and that we need to be aware of what this means for transferring data back and forth and what needs to be in place to do that. It is important to know that non-compliance with regulations, and particularly, all of them, but particularly HIPAA, can lead to substantial civil financial penalties for the institution. But it isn't just the institution that can be subject to those penalties. A person, an individual who knowingly obtains or discloses individually identifiable health information in violation of the privacy rule may face a criminal penalty of up to $50,000 and up to 1 year imprisonment. And it does get higher if it's malicious and intentional and knowing, but this is kind of the lowest of those penalties for an individual. So both an institution and an individual can be held accountable and subject to these penalties. Next slide, please. So when it comes to HIPAA and research, when HIPAA was drafted, the lawmakers intentionally took research into account because they knew that in this protection, when you write to really protect someone's information, you want to lock it down and store it securely. But they knew that advancing medical knowledge was really important. And in order to do that, researchers need access to the medical information. So they created really clear pathways for researchers to use data responsibly. And these pathways ensure that we have both privacy protection and support for ethical research. So the ways that a researcher can obtain access to HIPAA, protected health information are: one, you can de-identify it, and we'll go over that in some later slides, and then just run analysis and look at the de-identified data. And the other one thing you can do is you can get consent and authorization from the person and say, hey, can I have access to this? I want to enroll you in my study and obtain your information. Those that's always the best way. But when we're looking at big data and things like that, sometimes it's really difficult to get consent from hundreds of thousands of people to use their data. And also, if you're trying to identify people to be in your studies and figure out who might be eligible to be in your studies, you can't get their consent first without identifying them. So these pathways that they came up with, when you don't have the authorization of an individual, involve documentation, getting an alteration of a waiver of that authorization. And you can do that by going through an IRB or a privacy board. And if we're talking about Carillion's patients and Carillion's data, you'll be going through the Carillion IRB to get that waiver. We also need representations from the researcher when we give those waivers that the disclosure of the protected health information is solely to prepare a research protocol or for a similar purpose preparatory to research when we're doing those preparatory activities. And it's important to know, especially if you have joint appointments or collaborating with Virginia Tech, that the researcher regulation says the researcher will not remove any protected health information from the covered entity, and that protected health information for which access is sought is necessary for the research. So one, you're only getting access to what you need, and that it will not be removed from the covered entity. Let's see. We can also obtain access for research purposes if for research on the protected health information of decedents. So again, you have to show that it's necessary to answer the research questions, that you couldn't do this without de-identifying the data, that you actually do need identifiable data to answer your research questions, and you need to provide documentation of the death of the individuals about whom the information is sought. A covered entity may also use or disclose without an individual's authorization something called a limited data set of protected health information for research purposes. So I'm going to go into this more when I talk about de-identification, but it is possible to share data that has a couple of identifiers in it with someone outside of your, to disclose that without getting authorization. And I'll talk more about that in a little bit. Go ahead, next slide. Some additional requirements of the rule is, and this is for research, whether you're at a covered entity or not, always thinking about the minimum necessary. A central aspect of the privacy rule is that we should only be accessing and using the minimum necessary, especially identifiers or data that you need to answer your questions. A covered entity must make reasonable efforts to use, disclose, and request only the minimum amount of protected health information needed to accomplish the purpose. So instead of, if we are looking at a certain information that we need to answer our research questions, you can't just give access to the entire chart and have someone going through the entire thing. We need to be pulling out exactly what you need to answer your research questions. There are also requirements for data safeguards. So, and this it says a covered entity, but it's true for Virginia Tech when you're not a covered entity. You have to maintain reasonable and appropriate administrative. That means administrative are things like, have you taken the appropriate training to be able to access this kind of information? Should you be a person? Do you have the qualifications to access this kind of information? That's the kind of administrative protections we take. We also have to take technical safeguards, put those in place. And a technical safeguard would be things like making sure that you are changing your password frequently, and that you have the data are encrypted, things like that, that we rely a lot on our IT teams to help us with. And physical safeguards. So a physical safeguard is, locking the drawer, locking the office to the servers, things like that, requiring, identification to access those things. And this will come up later when Maddie and Nick start talking about where can you access this data. The reason that we have certain places you can and cannot access data are because of these requirements to put these safeguards in place. Next slide. So de-identification of data sets. It's important when we think about de-identification to have a good understanding of what that really means. What HIPAA requires and says, as far as how you can de-identify a data set, is that you can get a formal determination by a qualified statistician. So you work with a statistician to review the variables and the data that you're looking at, and the statistician certifies and asks themselves in documents that this, that this data reasonably would not be able to identify an individual. That I haven't seen that in my practice in research here at Virginia Tech. It's an option, but I don't see people using that. We do have a statistics lab that offers these types of services, and so it's certainly an option. I'm not sure with Carilion if an IRB, what the IRB will say to that. The most common way that we de-identify a data set is we have a list. HIPAA provides us with a list of 18 identifiers, and they apply to not just the individual, but to their relatives, household members, and employers. So that's important to note, and is adequate only if the covered entity has no actual knowledge that remaining information could be used to identify the individual. So I'm going to go over this list. Maddie, if you could go next slide. These are the identifiers. What is important to note? A lot of people will say, okay, I'm going to strip the name. I'm going to strip, the date of birth. Of course, I'm not going to share social security numbers. It's not needed for the research. I don't need those things. And email addresses. People think of that. But what a lot of people aren't thinking about is even things like the medical record number, which often a researcher wants to use to tie things together. You want to look at what happened, at the first of the year versus what happened to the last of the year to, this individual with this medical record number. That is an identifier. Other things that researchers often want to answer research questions are locations of individuals, like that these participants were from this location, tended to have a higher frequency of these symptoms. So location is often really important to answer research questions. But you need to note here that number 2, all geographical subdivisions smaller than a state, like location, that itself is considered an identifier. IP addresses. So when you're collecting surveys online in your survey tool, like Qualtrics or Question Pro automatically collects that IP address, you're collecting identifiers. These are things, to think about when you're designing your study and working with individuals. Another important variable that researchers often need to answer research questions are dates. So you really want to know that participant came in on this date and 2 weeks later their symptoms, changed, or after this treatment was provided on this date, and then a month later their symptoms subsided, or that kind of information. So a lot of research questions can easily be answered by stripping most of these identifiers. You most often don't need to have them in order to answer a research question, but dates and locations, we run into problems. Sometimes you can mask dates and, change things. You can make locations really broad and just say it was a rural area versus a dense population. You can do things like that, but often those are really needed to answer. You really want that granularity. And so because of that, when they were drafting HIPAA and working with that, they came up with something called a limited data set. And a limited data set is where you strip all these identifiers except for dates and location. And then you can share that data with a researcher for research purposes with a number of caveats. Again, you have to need those to answer the research questions, that the person receiving the data set is going to protect it, and how they're going to protect it, and that they will only use it for this purpose. So that's an important thing to remember about a limited data set is that it excludes all of these except for the location and dates. Another really important part of the slide is number 18. Number 18 is any other, and as an identifier, is any other unique identifying number, characteristic, or code. And so that makes a lot of institutions nervous. What else could be in here? That's why, doctors' notes and things, the note section is really hard to de-identify and share. Because if have this information about a person and you have this information about a person, and maybe there's a publicly available data set that has a third component that you could tie it all together and figure out who these people are, then the data is not considered de-identified. So this last number 18, anything else, is really tricky. And it can include rare conditions. So if someone has a condition, you have a 45-year-old female who has a condition that is very rare in women and in people under 80, right there you're starting to get things that are leading you towards the identifiable, and people are going to be concerned and want to have other protections in place other than de-identified data set to make sure that the data are protected. I think that's it for my section. I'm going to pass off. Maddie and Nick have the fun sections about all the things you can do. I'll pass it off to Maddie.
Thank you, Julie. That was wonderful. So now that Julie's talked to you about the why, we obviously still want to do collaborative projects. So the question is then how do we do that? So we want to talk about how we have access to our data, where we get that access, what the requirements are, and how you can step through that. So hopefully in this table, we won't walk through every single cell on the next few tables that we've got, but hopefully you can find yourself in your role. On the left-hand side there, we've got Corellian employee, Virginia Tech employee, which could also be a UVA employee or some other collaborator like that. It says VT student, that could also be Duke student. So we're this is largely an extra VT audience, so we wanted to make sure that it made sense here. And then of course the School of Medicine of ATC. So you can either see yourself in one of those, you probably also see external collaborators that you have on your projects, and this will help you understand what are the requirements to get access to Corellian systems and when do those occur. So one thing off the bat is to point out that everybody actually has the same requirements. Everybody, no matter what your role is, when you're working with research, you'll need a background check. You need an access confidentiality agreement, and Julie talked about that. There's an OIG exclusion screen that's run. There's requirements for vaccines and screens, especially if people are on site. And then there's the TSG component on the side here, which I've got a window on top of and hard to read. So it's all required for everybody. The only difference is when do these occur? So Corellian employees obviously have their background check at hire. Virginia Tech also has them at hire, so we don't redo that background check. Other students at Virginia Tech may not have that background check. So at the time that they are onboarding through our visiting student affairs, they would end up with that background check being done by their home institution. The School of Medicine, as all schools of medicine have background checks, we don't require another one of those. So that's sort of an example for each one. And similarly, Corellian employees all do their ACAs. We do them at hire, and we do them annually during our in-services. So anybody else who's getting into our system will do it at onboarding and annually thereafter. OIG exclusions are done monthly on absolutely everybody. Vaccines, it depends on the time of year. I won't get into that. So my main point on this one, and this slide deck will be available so that you can look through it, is that everybody has the same requirements. It's just the timing is different for it. So access for our systems for research, similarly, everybody has the same requirements. It's maybe just a matter of who's signing off. So for example, we have a Trinetic system. It's great for doing feasibility on patient population prior to IRB approval. It's de-identified. The licensing is coming through Corellian, so we do have some requirements. So for a Carillion employee, they just need their chair or department approval to have access to the software. That basically shows that the department or the chair is wants their team member to spend time doing this, and that's enough for us. For anybody at Virginia Tech, there's some different ways. Like a Virginia Tech employee comes through our research and development area. The School of Medicine goes through the dean, and then other Virginia Tech students also come through the research and development. And we basically want to make sure that if they're using Trinetics, that they're working with somebody at Carillion on a project or plan to if they find something is feasible to work on. Then for all of the rest, for using a Trinetics downloaded data set, getting access to Epic for a login for research review, access to our REDCap project or the secure research environment, which we'll be talking about more later. All of those require a Carillion IRB approved protocol. And the access each person will get will depend how that's written into the protocol, what their role is, and whatever is approved. And so that access happens after the approval on the protocol. PRISM is the protocol system that we have. So in general, mostly Carillion employees are the ones writing the IRB protocols. There are some times that Virginia Tech employees work so much with us on IRB protocols that they also get a login. We have to get them one of those logins and go through our technology services group in our IRB for that. The School of Medicine, they actually get an AD login and a Carillion login as part of their role as a School of Medicine student with us, so they can leverage that. And then typically we don't have Virginia Tech graduate or undergraduate students getting PRISM logins to that system because they're not in there frequent enough to justify so the license being taken on that. So there's also requirements by the data set type in terms of where these can be stored. So as Julie referenced, there's different levels of data here. The first one's aggregated. So if you think about this might be what you publish. Obviously there's no place that has to be stored because you're probably going to publish it. So aggregated information, noting that no cell size is less than 11. That helps protect the de-identification, as Julie was talking about, rare conditions or just uncommon combinations of things. You can also have a row level data sets, which frequently our investigators want to work with row level data and do analysis. We can have that de-identified, just as Julie was talking about. And then there are certain requirements, even for the de-identified, which typically wouldn't have as much requirements about where you're storing it. But as she referenced, just because you have a de-identified data set doesn't mean you can just do anything with it, put it wherever you want, etc. You may have other contractual requirements. One of the contractual requirements we have is with our Trinetics vendor. So when we get de-identified data from Trinetics, at this moment, we are required to keep that within Carillion's control. So we do have a solution of putting that into our secure research environment, which seems a bit stringent for something that's de-identified, but it's because of the contract that we have, not because of how the data sits. And so we have some storage requirements at a minimum level, and then we obviously have preferences, which is to have the securest possible for each of these. And again, this slide deck will be shared for you to look through. We actually break down the limited data set into things that are non-sensitive and sensitive data sets that are slightly different in terms of the stringency around them. Or our preferences, I guess. We would rather have the limited sensitive data sets within the Spark and secure research environment because, as Julie said, it goes into whether somebody could take that with another data set, do re-identification, and obviously there might be more harm if there were sensitive information in that data set versus just non-sensitive information in that data set. And then clearly there's identified non-sensitive data sets, and I think I lost a level of identified sensitive data sets, which would require Spark and or Carillion's REDCap, which is HIPAA compliant. All of this assumes, and as I know it's hard to read at the bottom, but all of this is assuming the patients are not consented for their use of their data. If the patients are consented for use of their data, then it's really whatever the protocol says and how it's written out, where can that data be stored, with whom it can be shared. It's all very protocol driven. So this is sort of assuming it's maybe large retrospective data sets where the patients weren't consented for their use and it was felt to be minimal risk And then we're looking to mitigate that risk as much as possible for privacy and security breaches. This is also assuming that Curling leadership has decided that whatever we are sharing is appropriate to share. I can't have somebody call me from, the local news station and ask me for information, and I even just share aggregated data. I need to make sure I have appropriate leadership approval to share whatever that aggregated data, even if they said, how many births do you have in your hospital per year? I myself wouldn't release that information. I would make sure that our leadership wanted that information released in that way, and there are appropriate channels for that. So as long as Curling leadership has decided that we can share this information, and typically that's handled through the IRB protocol if there is one. As Julie noted, notes are very difficult, and so we always at this point consider them to be identified and sensitive. We are not at the point where we have great confidence that our mechanisms for doing the de-identification and removing sensitive information is stringent enough that we have acquired that. So we consider that to be identified and sensitive, which would then automatically go into our secure research environment. And images, the determination around images is based on whether or not there's embedded PHI in the image, or if there's something about the image that could lead to re-identification, maybe something that's either unusual or might be identifiable. So that leads us to the secure research environment. We recognize the need and the desire to collaborate, especially with Virginia Tech, our academic collaborator. But it was difficult to collaborate in the systems that we had prior to that. For Virginia Tech to be able to get access, for us to be able to work collaboratively on projects and share data. So several years ago, we stood up a cloud-based secure research environment that we've called SPARC. It stands for Storage and Programs Accelerating Research Collaborations. That's our little acronym. It's accessible storage of research project data. And it also has advanced analytics programs there right next to the data. So you've got your program and you've got your data sort of seamlessly together to work. Because before it was like, well, your data is one place, but your programs have to sit another. And to get your data where your programs were, you had to take the data to someplace that wasn't secure. So the answer was to put it all in one place so it could be worked together by our investigators. We do have the folders in there are set up specifically for every single approved project. The access is limited to the research team as specified in the protocol. So for each person in the protocol, some people may not need access to SPARC. That is not their role in the project, and so they may not have access to that folder. But if it's specified in the project that they should have access, and sometimes we have de-identified folders for a project and identified folders for a project with different access for different people on the protocol. So if you're working on a protocol, just be very specific about who needs access to what, and know that likely we can accommodate whatever it is that you need. We just need to know about what the needs are. So all of these systems mitigate most of the minimal risk of a privacy breach. So the process is that once the access is authorized, which means that they have gone through they're on an IRB approved protocol, and that they have gone through the requirements we were looking at before in terms of the access confidentiality agreement, et cetera, things like that. Then actually the clients use their institution credentials to sign in, and that is with Virginia Tech. We have single sign-on with Virginia Tech, so you would use your, if you're Virginia Tech, if you're Corellian, use your Corellian sign-in, including your password. So it's not like you have to remember one more password, which is great. We do prevent data from being downloaded from the environment right now without appropriate permissions. So right now that's managed by my team to get that information downloaded. We are working towards having a more self-service solution there, but it's a work in progress. Again, we have to be very confident that our processes can appropriately identify whether somebody may be inadvertently downloading PHI along with maybe a summarized PowerPoint slide that has PHI embedded in the background, and we don't quite have those processes yet. So right now you would work with members of my team to get that information downloaded for you. And then SPARC is also, just as a side note, used for long-term cold storage of protocol data. So we do recommend that you write into your protocol that you will use it for cold storage. That means that after you've closed your project with the IRB and you've completed it and you're done, we zip up your data, we put it into cold storage for whatever the number of years are in your protocol that were specified for retention. And there it stays, and nobody has to think about it until the time comes many years in the future when it will automatically get deleted according to protocol. protocol. And if there's some reason you needed to recover it, prior to that, you could reopen with the IRB and go through a new protocol process and we can recover it. And that's the point of cold storage is it's not easily accessible, but it is accessible when it's needed to be with the appropriate approvals. So that is our environment. And now I'm going to turn it over to Nick to talk about how the researchers are using this environment.
Great. Hey, thanks, Maddie. And to Julie before you, this is great. Hey, everyone. Again, Nick Ryder. I'm an allergist immunologist here in the system and a researcher. I also am an informatician. So I want to provide this perspective not only on how Spark is used as a researcher, what I'm doing with it and how others are using it, but also kind of maybe where we're going to be going in the future with Spark. And we're looking to grow it for sure, and we're interested in scaling it. So, from a researcher's perspective, I mean, you heard beautifully from Julie, just, the things that we all are concerned about in terms of doing the right thing with data, but also, we want to be potent with data. We don't want to just keep data siloed away, protected, and never used to improve the state of the world. So the great thing about a secure research environment like Spark is it really allows us to balance those two things. The secure piece often is, kind of conflated with, okay, the institution's protecting the data. And yeah, that's true. And again, a nod to all the great information that Julie provided, but also as a researcher, your project is protected. If there's, concerns about data loss or code loss, the HART team can actually recover these things because they're in a secure research environment, as opposed if it was, residing on one of our own private machines where we would really be on our own in troubleshooting. So, Spark really allows this secure space to do the right thing and centralize management for collaboration. So you can think of it really in three ways. One is storage. The second is tools. So having the data in a place where it can be stored and then the tools around it to do the kind of analyses that you want to do. And then the third is really the compute piece. So we'll talk about all of that in subsequent slides, but ultimately Spark and secure research environments like it are being used not only here, but nationally, internationally at institutions just to be able to do the right thing. Next slide, please. So thanks to Maddie for this wonderful schematic of really what Spark looks like now. She did a wonderful job of defining what a trusted user is. So I'll reference you back to that slide. And then where needed, certainly as an external collaborator, data use agreements would be in place, as would an IRB protocol prior to having access to data in Spark. We'll call out the many, many functions that the health analytics research team provides, as well as additional services and software. We'll talk a little bit more about the software, but they do provide data extracts. So you currently don't have to pull your own data. They'll liaise with you to make sure that you get the data you want instantiated into your project file within Spark. They will connect REDCap functionality to Spark, as Maddie also talked about, using Trinetics data set, which I'll say parenthetically, my team is using this data set. It is actually a really terrific resource for both Carilion-focused patients as well as national level US representative data set for a wide host of use cases. So having availability of that to be pulled for your specific approach for whether it's observational research, epidemiologic research, or other foci, great to be able to pull that kind of data into Spark. They also do help with de-identification and verifying that, study design, helping to perform analyses and biostats if your team doesn't have that capability, training on tools, informatics support, and they do have an office hours availability. In terms of what's in Spark, again, we talked about the tool piece and the processing. There is native compute there. There's GPU capability there, depending on the type of project you're working on, and a suite of tools that we'll talk about just briefly in the next slide that you can leverage within the environment. Next slide, please. So this is some of the software that's there. You will be very familiar to many on this call. SAS, R Studio, and Python, for those of you who want to code and do a variety of approaches with those software packages. excuse me, NVivo, the qualitative software. Genius, I have never used, but I understand that it is for microbiology and genomics of microbiology. RoboFlow is a image processing platform, and 3D Slicer is as well. ArcGIS, I know many on the call are familiar with this for using geographic functionality mapping and a whole suite of tools there, as well as basic Microsoft tools. So lots of tools that are already present in the Spark environment that will be made available to you as you need, for your individual software or your individual use cases. Next slide, please. So the question often comes up, and my team asked this question too: how do we, ensure that the software I need for my approaches, and in particular, if you're using, R or Python, you may want to be used to, pip installing packages and so forth. How do I ensure that all of that will be available to me? Well, for sure, engaging with Heart will help you ascertain whether the software that you need for your project is available, and many, as already described, are available. And again, my team is doing everything from wrangling data, large Trinetics data sets, with hundreds of thousands of patients in the environment, using R and Python and all of the packages you would expect to use to do that. They're doing statistical modeling, they're doing data visualization, they're doing model building, machine learning model, statistical model building. So all of the kind of software for those types of approaches is available to you. But inevitably, we'll continue to push the boundaries, which is fantastic, and ask for new software. And so there is a process for that, and I'm currently connecting through Heart to do that. Is the appropriate way to go through that new software onboarding, because a number of factors need to be taken into account. Certainly, is there already a solution in place that could be provided to you? If there's not, then certainly costing that, understanding what the cost of licensing is, at the institutional level, doing the VRA, the vendor risk assessment, to make sure the software is safe for the environment, and even just making sure that indeed the tool and solution that you want is potentially the best option for you, and working with you to figure that out. Certainly with Workday being onboarded, there will be additional functionality through that that will allow us to, as researchers, put in software requests and have some transparency around this. But the other caveat is that if you have software from a VT software license, that is something that Corellium can't install. So we would need the Corellium to have a license for that software. Next slide, please. And then I'm just talking a little bit about the compute, not wanting to put anyone to sleep here or read alphabet soup to you, but just to say that there are a number of layers of functionality around compute, everything from just base compute for doing very simple analyses to leveraging GPU processing for more complicated analyses. I will say that for building things like transformer-based models, or bringing large language models into this environment, we do need to grow for that level of functionality, and we're looking at that. But for building standard machine learning models, at this point, Spark has the capacity for that, and it is quite good for that. So again, this is a nod towards expanding functionality that's already there, in really kind of in alignment with what researchers here need for their projects. Next slide, please. So that is where we are. Where are we headed? There are a number of best practices that can be gleaned from the literature and in talking to other institutions that are, further down the maturity path than we are, because they have had longstanding relationships with an academic partner as a health system, or they themselves are all under the same umbrella, that being the medical school, for example, and the health system. And so Stanford, of course, is a terrific institution, and they have greatly, really wonderfully published their infrastructure and what that looks like. And so I'll just show a couple schematics. The first schematic here is just showing their infrastructure, where they have a research informatics team that interacts with a secure data center where you're extracting, transforming, and loading electronic health record data into a clinical data warehouse. That's the CDW, the STAR OMOP CDW, for anonymization. And then you have this workflow where you can take this anonymized but very diverse institution level data set born out of the electronic health record, that passes through a privacy board review and then is instantiated or placed within a secure research environment. They call their version of Spark Nero. And you'll see they have an anonymized clinical data warehouse, and then they have a complete de-identified. So they have an anonymized de-identified data set there in a common data model called OMOP, and then they have one that is maybe more of a limited data set. And then you as a trusted user on the left, this looks very similar to the schematic shown earlier with your data use agreement and IRB in place. You can either pull your own data from the anonymized clinical data warehouse and the common data model there, or you can go through an honest broker consultation like Hart does currently for us in ascertaining what data you want, having it pulled from the clinical data warehouse and then placed into the secure research environment for you. So a lot of this looks very much like what we have in place, and it is indeed very much like what we have in place. I think the difference is that we're looking to have to hopefully bring OMOP online in our environment, so the electronic de-identified or a limited electronic health record data set would be available in Spark for mining or for pulling by Hart. And then just one additional click. So ultimately the future state then, if you see these verticals in this schematic or this diagram, within the secure research environment, again, you have the data processing as the first vertical, and that will be continue to be enhanced. You'll have the data sets as Stanford does, and these may be structured data, they may be unstructured images or signal data that can also be stored within the secure research environment. And then you'll have the tools and software, which will continue to grow, again, depending on how researchers need them. And then, again, Hart already provides office hours and training. We look forward to expanding that as research functionality needs to grow. But what you can see is that here at Corellium, we do have many of the elements that a place like Stanford already has in place. We're just looking to grow all of this and are excited to do so. Next slide, please. So in summary, Corellium is not only valuing but dependent upon external collaborations with partners like Virginia Tech. I'm grateful for that as a Virginia Tech faculty member, and I've taken great advantage of that and can speak to that. And I'm happy to take questions at the end of this, as well as have you reach out to me. Corellium is governed by regulations surrounding PHI sharing. They have implemented the processes, as both Julie and Maddie have described around securing and sharing data. Next slide. And, just to underscore that Spark, our secure research environment, does provide, powerful tools, storage, and compute really to solve a wide variety of use cases, and it will continue to evolve and expand. And I think that is the last slide I want to say. Yeah, so with that, I think we can open it up for a Q&A, and thanks to everyone for your time.
Absolutely. And thank you guys so much for the great information. Lots of people in the chat saying that they are using Spark. So that's good. Any questions for our presenters today? Feel free to unmute or pop something in the chat. We can convey the message. You guys did such a good job. There's no questions because you covered everything. All right. Yeah. Thank you, Dr. Schlubner. He says nicely covered. So you guys did fantastic. If there are any questions, feel free to reach out to us at the OCPD office or, any of our presenters. I'm sure would be willing to answer further questions over email. It sounds like, there's a lot of things to be excited about coming in the future. So, stay tuned for further developments and further ways that, Corellium and VT are making research better, easier to navigate, and more secure for the future. So thank you all for joining us today. Thank you to our presenters. We really appreciate your time and expertise. And if you have any questions or concerns, feel free to reach out and have a wonderful rest of your Thursday. Bye, everyone.